Community Health Mayor and Council Stakeholder Discussion. So we're talking, it's about community health, and it's the Mayor and Council Stakeholder Discussion. So any of our stakeholders that would like to join us, if there's not enough chairs, we can, there's a chair right here that can go. And then there's a chair beside. Oh yeah, you can pull up any, right there as well.
Madam Mayor,
afternoon. Yeah.
if I could, in kind of a sense of introduction to this topic, Senator Quarterman sent a letter to us dated July 24th, where he falsely claimed our city is in crisis and under siege. One of the items that he identified was number 6, call on the Public Works Department and the Washington County Health Department to clean up the core of the city, literally clean it up. There are needles and feces all over the place. Should the health department continue to promote and provide needles in our community, which is a state law, they should be held accountable by the city and should be the ones cleaning it up daily, not the city or our citizens.
What number was that, Councilmember?
Number 6.
That was number 6, thank you.
So I just wanted to identify that, as we discussed last week, Councilmember Alshire's comments was we should address the senator's concerns and issues.
Do that in
So
pieces.
while I
Thank you.
don't personally agree with his characterization of the issue, I think, as Councilmember Alshire said, it's important for us as a mayor and council to understand the issues and understand what the reality is. And so pleased that we're joined by members of the Washington County Health Department and including the health officer.
Yeah, thank you guys so much for being here.
We're on tour.
We're on.
Councilmember, you
Take
just
it.
made the job so much easier, but thank you for being here. And at the meeting yesterday as well. I think that it is important for the public to know that this was number 6 on the letter, in which we're addressing. And we will address the letter with agencies piece by piece for the public and also for the media that's here. We will address them individually. So,
Okay.
welcome, thank you.
So, just a couple points of clarity before we get into like the actual harm reduction program. I know that, as a community, we obviously continue to have a pretty significant behavioral health issue, mental health and substance use disorder. Specifically with substance use disorder, which is under our purview at the health department, we have really robust community partnerships. It's not just the health department that's addressing the issue. To that point, and knowing that we still have a long way to go, just received data yesterday that if you compare our first 6 months of this year with last year, we've had a 59% reduction in our overdose fatalities. So I know that there's a perception out there that, nothing ever changes and what we're doing doesn't work. Well, we've had almost 60% reduction in basically saving people's lives. So again, we still have a long way to go. But the things that are in place now are working and are keeping people alive. The other is that the greater substance use disorder issue is going to be here. And I said this when we were here 3-4 weeks ago. Until we collectively come together as a community, it's not just a health department issue. It's not just a, nonprofit issue. It's like everybody collectively working together, moving forward together in lockstep. And I would emphasize with key influential people and entities in our community also supporting the initiative. Because I've been at this job for 31 years, been to many meetings, many task forces and the whole nine. And if you don't have people and entities of influence, it's gonna fizzle. It just is what it is. So the only way to really hold people accountable is to have that influence, and then to have those people at the table and in it for the long haul. And then the third point, and we'll kick into harm reduction, is that with all that said, harm reduction really is an infectious disease program, prevention of infectious disease. Secondary to that is, getting people into treatment and on all that good stuff. But it really is focused on preventing the spread of infectious diseases, mainly HIV. And I think that Councilman Alshire has pointed that out on several occasions. But I just wanted to make that clarifying point again, because a lot of people that I talk to are under this misnomer of like, well, you're not getting people in treatment, you're not doing this. This program really isn't for that. That's a secondary objective or a secondary goal. So anyway, just a really quick, how did we get into this? Why are we doing it? All that good stuff. Back in, I believe it was 2016, we were approached by the Maryland Department of Health Infectious Disease Program. At the time, they were, CDC was just coming off of a significant outbreak in Indiana, Scott County, Indiana, which is demographically at the time very similar to Washington County. Significant rise in HIV cases, you know, the whole nine, all the issues that we're experiencing now. One of the things that they did was implemented a syringe service program. To save a long story, cases went down. They did get people into treatment. It's really meeting people where they are, and all that good stuff. So we were approached by the state, the CDC, on the heels of that, had done a vulnerability study, and we were in that vulnerable area. But at the time, it was mainly our neighbors to the south. It was Berkeley and Morgan counties in West Virginia. Again, very transient commuter population here, especially even with at-risk individuals. Working with our opioid intervention team at the time, which is now opioid prevention, overdose prevention team, we decided to move in the direction of, you know, hey, we've got to do something. You know, we don't want to be a Scott County. So we moved forward with having a harm reduction program inclusive of a syringe service component to that. We understand, you know, from the get-go that the potential for a needle litter was there. It's something that we've watched and fretted over the years. There have been some discussions with you guys over the years. Not literally you guys, some of you guys, but the council over the years and with city administration over that, which obviously has kind of come to a head now with the letter and the subsequent meetings that we're attending. We continue to feel as though it is a needed program. Our intention is to continue to move forward with it, but we also recognize and share the concerns about, you know, if the community is concerned about seeing needles and finding needles and all that stuff, that's certainly something that we needed to really take a look at. I know that there are several communities across the country that have done away with their needle programs. I don't want to steal any of Dr. G's thunder, but they've seen some subsequent ill effects of that, kind of back into the mix, back into the frying pan, so to speak, with where they had come from. So just so everyone's clear, and I don't necessarily know that this was a question, I'm not accusing the council of anything, but our intent is to continue moving the program forward, obviously tweaking it specifically with some, you know, more robust needle disposal, which Vicki will talk about here in a minute, and education specifically for not necessarily the community, but the individuals that are in the program. Yes.
Can I ask a question just to throw on the table before, as we discuss, and how can we make sure that we take care of addressing the spread of infectious diseases and, right, because I don't think that this has to be a win or lose situation, and address the issues that's happening within people's personal property, those types of things. Also, if you guys could please tell us what law enforcement can and can't do if they were to, because I get this question a lot from community. If they see someone that is actively shooting up, they call law enforcement. Can you please just say if you know what law enforcement can or cannot do when if they get to that location, in reference to what policies or whatever is in place. And the reason why I'm asking specifically of that is that I don't want the public to think that there's a favoritism or there's just an addressing one type of issue. Because there's the issue of public safety that is not violence-based, but it absolutely is to the condition of what some people are seeing when they walk out their front door. And so if you could just help me understand, and maybe that's around the programming and the robust rollout, right? Or working all together, but how can we do both? How can we address that, make sure we meet people where they're at, but the same thing when it comes to property owners and public safety?
So from the standpoint of your first question, I think with property owners, if I'm understanding it, what you're asking is what can we do about individuals trespassing?
No,
Or-
I'm asking because I think the health department, it sounds to a lot of folks that the health department only cares about, and I'm not saying that's the case. I
Right.
just I wanna put it out there for the public that's listening, that the health department only cares about the people that are suffering.
Oh, okay.
And
Okay, gotcha.
in the illness, and also making sure to protect them. But how can we make sure that the public understands that the
Right.
health department is, and what can we do to make sure? And that's not saying it's your responsibility, right? I agree, it's an
Right.
entire community, it takes all of us. But what I don't want is the public to feel like they have no way to express their concerns around what's happening outside.
Right.
I also don't want other folks to feel as though there's not any consequences to disrespecting people's personal property and safety when it comes to this elected body.
So I'll start off and then I'll have Vicky can chime in because she's closer to that than I am. But we certainly understand the need to respect individuals in the community regardless of whether they're in active addiction, a homeowner that doesn't have any behavioral health needs. We certainly want a safe and healthy environment for everyone, which is why we've constantly over the years really looked at the program. What do we need to reevaluate? It's why we're sitting here today. Vicky can talk about some of the conversations that she's had with you guys, in particular Councilman Perini, with some of the new initiatives that we're kicking off and those sorts of things. So just so that everybody's clear, our concern is truly for the entire community. The harm reduction program doesn't just protect individuals in the program, it protects your community also. And some of the initiatives that we're
But I think that some of the concern coming in from the community, if it's not being done appropriately, that it's not protecting the safety of the community. For instance, kids getting ready to go back to school, and I know that we've talked about it, right? And so I'm not doing this I'm doing it for the public, to be able to clearly understand, and that we're having this conversation. School's getting ready to start. The safety of the community is not gonna be, if the needles aren't being returned.
Right.
And how can the public and all of us make sure that we're holding people accountable that do not want to go into treatment, but constantly keep breaking the law by being on people's property? Because I think that that's one of the things that is a huge concern.
So we don't have any control over whether, from a criminal justice perspective, if someone's trespassing on someone else's property, the health department doesn't have any control over that.
I understand that, that's our job,
But-
right.
As far as needle disposal and needle litter, I'll let Vicky come in on that and what we're doing with that.
Well, I think one of the things that we've done is talk to the participants about respect, and that's not what harm reduction looks like, because harm reduction looks very different from being on someone's property, being disrespectful, littering, and things like that. So we've gone out, and when we go out for collection, we've taken pictures and we've put them up in the rooms. So we're having conversation when they come to the health department about that. We've also, when people call us and, kind of good and bad press, this has been kind of good press for us because people are calling us more. So we're having more conversations. So instead of it going on social media to be made fun of or negative comments, we've had people call us and we've been able to go out and have conversations with them and say, hey, if this happens again, call us. If they're standing on your doorstep, call us. We'll come out and talk to them and move them away and have a plan. We've also made suggestions, maybe you should get lights that are, motion lights. And she said the neighbor had done that and she was gonna ask her boss if they could do that too. So having that conversation, because like Earl said, it is about community safety. So we're here, we are here and we've even increased our outreach. and don't have a problem, going out. As far as like trespassing and people who are destroying property, those are all divertible problems that can be brought to us. We have law enforcement assisted diversion. We have a crisis team. We have no problem going out and working with those individuals.
And how would the public be able to reach you? Is it straight through the website or the?
Actually, they can call the main line and it'll come straight to me. And so we probably would enroll them in the LEAD program if that was something that we thought was appropriate. And that is like discretionary funds, so we have more opportunity to get them services that they need.
What's the number?
A 240-313-3310. Do you want me to continue, or do you
Oh,
want
sure,
to
go ahead. I was
G?
waiting to see if there were
Oh,
any
questions?
questions.
No, I just wanted to throw it out
Okay.
there for the discussion. Thank you for answering, but those are the concerns that are coming in. So
Do you
thank
want to add?
I could say a few words just to, I mean, it's just sort
Go
of
ahead and introduce
reinforcing.
yourself.
Oh, I'm sorry, I'm Deanna Gabiri, I'm the medical director, I'm the deputy health officer and medical director. Just sort of reinforcing what Mr. Stoner has said about the infectious disease aspect of this. This is really just one of our tools in HIV prevention, not just HIV, hepatitis transmission, but particularly HIV, I think, because of the Scott County experience, knowing that those situations can quickly get out of hand if there aren't prevention strategies in place. We have a PrEP program, which is daily medication for prevention of HIV infection. We have reaching out and doing early detection and treatment. There's a phrase in infection control that treatment is prevention. If you treat people, that you stop that transmission. So we are very active with that. We're working in the hub with an STI clinic doing testing. Behavioral health does a ton of testing at their facility and in street outreach, as does our case management program. Our HIV case management program does a lot of testing. And then syringe services, and all of these programs work together. Syringe services has been a tremendous tool in HIV prevention. We know that large percentages of people who are diagnosed with HIV report injection drug use. You can't, usually you can't say it was acquired because of this risk factor, it was acquired because of that risk factor. But of the people living with HIV in the county, 75% reported injection drug use at the time of diagnosis. So it's clearly a huge risk factor. And I think there's a perception that if there's an outbreak, it stays within a particular risk community, but it doesn't. It didn't in Scott County. It is a community problem. It's not just a small sector of the community. And to Earl's comments, and this may be overstepping, but it is true that in places where they have curtailed or suspended their syringe services programs, particularly in our neighboring state of West Virginia, in Cabell County where Huntington is, in Kanawha County where Charleston is, in Cabell, they severely curtailed the program, and in Kanawha, there were so many restrictions that they eventually just suspended the program. Both of those counties had significant CDC-involved outbreaks of HIV within a year after they cut back on their syringe services. So we know real-world examples that these programs really are important for infectious disease prevention.
I have a question. First of all, thank you very much for the focused outreach, especially in the area that I live, and I appreciate the social media announcements that you're here and the things that you're doing, and all of that helps tremendously. Do you notice that it is the same individuals that you're helping in the harm reduction program, and then they come back and they're still kind of in the program? Because what I see, it almost is a new group of individuals around the Goodwill, around Reach, on North Prospect, and then so they're there for a while, and then it shifts, like the groups shift.
It's like it migrates and
And I don't know if it goes to another part, if they go to another part of the county or the city, but it's like this different groups of people, and they're there for a while, and then it kind of goes away. What do you see?
I think it's hard to say. We see the same people for a couple years. You know, you have that handful of individuals, can't name names, but everybody knows them, you know. And you do see some fluctuation. And I always ask first, what brought you here? Well, I moved up here to be with a boyfriend, and I know we had talked about the treatment issue. Very rarely, if I find somebody that's stuck here because they were kicked out of treatment, I send them back. Really, I do. Like, if you need I send somebody back to Baltimore, and I've had people come to the office, and I'm like, you don't need to be here. I have funding for transportation. I just send them back because it's not.
That's good to know too.
It's. I mean, we might not have all the funding all the time, but you know, when you find somebody and you have that funding, why would they be sitting on the streets of Hagerstown when they can go back to Baltimore where they live and have a home?
That's another thing that I'm glad you said that, because that's another thing that people are saying is happening, is that someone's bringing and dumping a bunch of folks here, and then if they get kicked out of the houses, that there's no way for them to get back to their location, or if they're from Baltimore or whatever. So thank you for saying that if you guys do run into someone like that, that you would help them, you know, if the treatment didn't work out here,
Right.
that you would help them get
And a
back
lot
to
of
their
places do that. I mean, and also, I think there's a misunderstanding that people are kicked out. Sometimes they leave on their own. And I know we had talked to Scott about this. We send people out of town. When people come to us, whoever has a bed, if they're willing to go, we try to get them there. So it's not like we're always placing people just in our neighborhood. We're placing them in other neighborhoods too, you know?
Well, and I think
And
it's a-
trust me, they are very resourceful, and they usually come back real quick if they want to.
Well, and I think it's very important to note that it is extremely, just because there is a person that needs treatment, if it is 3:30 on a Friday, or if
Yeah.
it's 4 o'clock on a Wednesday, it is likely not going to happen.
Yeah.
Yeah,
So,
and we-
and that is like very,
Yeah.
very important to realize.
Yeah, that's definitely
It
important.
typically takes a long time.
It does.
In many methods of, they may have overdosed several times and heard a message from a peer over at Meredith, maybe street outreach, maybe a personal experience, before someone really, and typically it's right after a crisis. That's when you
When they're
really,
ready.
because again,
Yeah.
an hour later,
Yeah,
you've lost that opportunity
That's right.
for most people.
that's right.
That's important.
Well, and I think too, and like I said last time, it just takes so long, and I know we want answers and we want somebody to be well right away, but it really is about building that trust, having that relationship, because of all the systemic issues that have come before we've got in front of this person.
I think that and I'm gonna let some other folks talk, but I think that for me, that building the trust is definitely, you know, the most important thing. But as Councilwoman McIntyre said, if you're seeing different people and different faces, I walk a lot. And I mean, there's a couple of different spots that I see. And it's difficult for me to build a new relationship or say hello, like constantly if there's new faces throughout. And so I just want to, again, it's hard because I'm seeing so many new faces and shifting. Like I'll see them up towards Goodwill. But then if it moves, then they're down on North Locust and between Randolph and, you know, and those could be the same faces, but I'm also seeing brand new groups of people. So that's hard to kind of build relationship.
What I mean, if you want to know about, I usually take someone that is there all the time. Like I have a couple people that I have relationships with, and they are kind of like that warm handoff person. So, and like one person has come out with us for a little while on Friday evenings. Like I've asked her to come, and she's in the street. I
That's
mean,
good.
So
That's good, though.
she
That
goes
goes
with us. And to say, well, this is my caseworker, but I'm not.
But kind
She's
of
okay.
to introduce
She's
you
okay.
to
yeah.
the folks.
Yeah.
Okay.
So, it does take a while to build relationships. But I think, one of the things I think is very important, especially when we talk about harm reduction, well, a couple things. One, it does not promote drug use. That is not what we're doing. And we do not accept drug use. I mean, that is very clear. That is not something harm reduction is about. It is about keeping people safe, right? We're not saying go out, do drugs. I think that's sort of a misperception. And the syringes are only such a tiny, tiny part of actually what we do with that person. Unfortunately, that's what gets attention. If you looked at all the services that we do, wound care, sexual health, hygiene stuff, HIV testing, hepatitis C testing, I mean, it is referrals. I mean, we did 371 referrals last year, and that's only people that walk in that room. That doesn't mean on outreach, that doesn't mean our peers. So there's so many other things than our harm reduction program that gets people into treatment. It just takes a while. But now we're gonna take on something new with Peter. You wanna talk about it?
Councilmember Asha, I seen.
Oh, sorry.
I only have a couple of comments. So, I mean, obviously for me, I recognize each of the points that were made in this communication. And as Councilmember Perini points out, obviously we invited you folks here to talk about point number 6. And so a couple of things first before I get into that. One is I completely respect your comment that everybody has to be on the same page and at the same table. And so the first thing I'll say is, we did invite, in addition to yourselves, folks from Meritus to participate in this discussion today. I know that they declined to attend. And for me as a citizen, the difficulty I have with that is this very new sort of part of learning this process, that this is really a medical issue, that you're not out literally handing out needles and going, hey folks, we know you're drug users, go use drugs. You're really looking at the back end of this and saying, what impact is this going to have on the broader community, on the medical side, that we can glean from the impacts that it has had in other communities on the medical side. So I really appreciate you attending today and speaking to that issue, because I think as just an average citizen, trying to sort of push out all of the rhetoric that you hear and see and read on social media and in all the facets about the subject matter, that has resonated well with me. But in this letter it says, it uses the word should. However, should the health department continue to promote and provide needles in our community? And by the way, you guys did a great job yesterday in answering a number of questions. And I tried to write down the stuff as an average citizen, what I would want to hear and take away from that discussion. And it's completely unfortunate. I'm so glad that you're here in front of us and in front of our citizens. That was my goal, because having a meeting, in a private setting over at the library on 3:30 in the afternoon, the citizens aren't hearing the appropriate facts and figures and things that you're saying. And I think that that's even more so important in this day and age of the immediacy in which we can transfer and communicate and miscommunicate information. So you are an arm of a state agency, right?
Maryland Department of Health.
We
Maryland
are-
Department, you're
we're
the
a
local arm of that sort of.
We're technically not a unit of state government, but governance-wise, in essence, yes.
That's right.
Yes.
And so when it says should here, I want to make sure I understand that word should. Because it clearly is indicated that if you wanted to decide tomorrow to stop providing needles, you could tell the state to go pound sand, we're not going to do this program. But you are certified and directed under state.
We are not directed by the state
Okay.
to have the program. We are strongly encouraged to have a program,
Okay.
but we are not mandated.
By the
We-
state, from
By
the
the
state.
state to
I think those are
have a
completely
program.
good things to learn.
Yes.
Yep.
So, and you are the only certified entity, agency in this county that provides that
Correct.
service.
Correct. So to your point, just for people watching,
Mm-hmm.
in order to give out syringes in this case to individuals who have substance use disorders through a harm reduction program. You have to go through a certification with the Maryland Department of Health, which we obviously have done that. But you must be certified by the Maryland Department of Health to hand out syringes, clean syringes, obviously, to individuals through a harm reduction program.
And we go through a grant process yearly. All of our staff have to be trained.
Through the
Our-
state.
Through the state, through the Centers for Harm Reduction. We have TA calls. And it's reviewed every single year to make sure that we're doing it according to the guidelines of which the state has set up. And we were the second one in the state next to Baltimore. And now I think we're at 24 are on board. There is a Maryland Syringe Service Advisory Board, which I actually sit on. And they review I don't review my own, but they review all the new applications, and they talk about the laws and,
For the 24 jurisdictions in the state that participate in
and
this.
it will be all of them. I think right now, there's only Garrett, but Garrett's being shared with Allegheny right now, and Carroll just finished their application.
So,
And to be clear, all of those harm reduction programs, all of them don't distribute clean needles.
Right, but it's
I don't know
still
how,
through,
all of them don't, because Garrett County does not.
Garrett doesn't have one.
Are
They
they
get it from
in
Allegheny.
Allegheny.
Yeah, everyone that I've read does do syringes. Garrett doesn't have a program. Allegheny's going to Garrett.
Okay.
Because of the increase in HIV
Right,
cases.
okay.
so the portion of your participation in that meeting, Paul had indicated, he says, "I don't want to get rid of the needle program." That was the first comment. But he talked about interest in a one-for-one exchange, and you're very good in explaining, one-for-one exchange isn't, addressing the medical side of the
Right.
infectious process, which is what the goal is. But I did like the two comments that you pointed out, and I think, again, as a citizen, this is just me as a citizen sort of listening. You said in last year, 2023, 22,000 needles went out, 12,000 were basically collected. This year, 16,000 went out, you've got 19,000 back
Yes.
so far.
Yes, they're good.
So, and
2024,
Earl,
yeah.
you made a very good comment in response to that, that this is a lesson learned process. That this isn't, something you pull out of the box and it works perfect day one. You're addressing the issues of the program, how it operates, the accountability associated with it. And so I think that was very good. The other question that was raised, Paul says that we need a program in place to proactively pick up needles. And you said very clearly, you already provide that program on a daily basis. Doesn't matter what day of the week, you even said Friday nights. If somebody calls, and then Earl kind of touched on the thing that I'm gonna let Councilmember Perini touch on. I know that you also advocated for disposal boxes. I know that is, a bit of a lightning rod in the case within the community. And I want to go further because I think it touches on the point our police chief made, and I think it goes to the mayor's question earlier, that HPD can't be the continual sort of cleanup crew of this item. And I think it speaks to your comment that everybody has to be at the table. And then another question was raised, which I thought was good. Paul said, how do you keep tabs on the repeat users, meaning the folks that continually come into your office to obtain clean needles? What is the process there? And you said 590 individuals came in for needles in the last year, and of those, 370 asked for help through the Washington County Health Department. So, this misnomer out there that people just come in, they grab them, and they cruise, and that you're not, sort of addressing that at the front door, so to speak,
And can I
before they
just-
leave. Was
can
that,
I-
so those were good numbers.
Well, I think too, when we talk about our program is evolving and learning, we have really good staff. I mean, when you first start and we're trying to train and figure out the way it goes, people would come in, and I'll be honest with you, they'd come in, grab their stuff and go. And now I've moved my office is right beside the room. They will spend a good 15 to 20 minutes. Sometimes I have to knock on the door and say, are you okay? So like my staff is like learning the process of keeping people engaged. You know, so it's an art, like peer support services, and we work daily to try to improve quality of care, period. I mean, it's just like a healthcare office, I guess you would say. And we talk about what can we do differently, how can we engage them, even if it's candy. I mean, and I will invite all of you, please feel free, if you want to do a tour, we could walk you through what it looks like in our offices. From the moment they come in the door, we want to make sure that they're engaged, because we know we have to keep them engaged to keep them there and to build that trust.
And that's also one of the points of outreach also. It's not just literally walking down the street and like, what do you need? I mean, every touch point in that process is education, an educational opportunity. And ultimately, a trust and rapport build with that individual to slowly get them through that process. Because the harm reduction program is based on a scientific model. It's based on the stages of change model and pre-contemplation and all that kind of stuff. So, you know, it really is meeting the individual where they are, and they could be anywhere in that. Now, most often, they're in that pre-contemplation, but you try to move them along through those stages, and ultimately, while you're keeping them safe and reducing harm, getting them into treatment.
So, to the effect that this letter was conveyed to mayor and council, wasn't conveyed to you folks or the other entities that are clearly partners in this process of a broader issue, you know, the question in each one of these entities and that we meet with is, okay, here's what you do, here's the issue, what's the city's role? So that's sort of how I'm approaching each of this. And so it was good for me to hear yesterday that one, our role is certainly, you know, in partnering with, you know, identifying where these issues exist and engaging you in that cleanup and accountability effort. But two, I did find it interesting, you already mentioned it, that I took away from the meeting yesterday, which was the alleys. And the issue with lighting in the alleys and individuals basically looking for places they feel safe, you know, in dark areas to do this. And so I sort of took away from that, you know, that's an area where, you know, the city could engage ideas to address that, because I think that speaks directly to our residents, especially in the residential areas that feel most directly impacted by it. So I appreciate those comments. And then,
Anybody else?
I did have a question for you. I'm sorry.
No, go ahead.
Yeah, I did have a question for you. The one point the Councilmember Alshire made is my big takeaway from yesterday's meeting. We hear it, I'm sure you hear it, that the needle program is why there are so many needles, right? We're finding so many needles on the streets. The numbers that you guys collect for the number of needles distributed versus the number of needles that have been returned, that returned number, is that actually people that are bringing needles back to the health department, or is that a number of needles that's being collected?
Both. So when we go out and collect, we bring back what we've collected and we put it in one spot. So it's all together. And people bring in needles that aren't using substances, diabetics, women who have done infertility, like they just want to get rid of them properly.
Right. So I just wanted to point that out, that number was eye-opening for me yesterday. The fact that, and I don't know if you still have that handy, but I wanted to reiterate that the amount of needles that you've distributed and the amount that you have collected right now is way more on the returned
Right.
than it is on the distributed.
It's about 3,000 over.
Yes, sir. So I just thank you for that.
Before Councilmember Perini does his thing and shares with us this new thing, do you guys tell the folks that you're coming in, whether it's for harm reduction or for, to get treatment services, do you tell them that the state law says that they can, kind of sleep anywhere and use the bathroom anywhere and drop all their stuff anywhere? Do you tell them that, like, the state law is in favor of, them making sure that they can, do what they want to do and there's nothing that can be done to them? Is that the message
opposite.
that you send out?
I mean, that's the exact opposite. You know, when Shelly told me people were coming in her backyard, I told them, you've got to stop going in Shelly's backyard. I was like, hey, she has a Ring camera and I've seen you.
Yeah,
Just stay out
they
of
have it
there.
now. They don't have it anymore.
But I'm just,
I just wanted to say that because
but
there's
no,
this whole thing that,
we totally
you know,
have these conversations. And like, one of the big things is that that's not our harm reduction. We respect you and you need to show us respect outside of the room. We call the harm reduction the room. And we have conversations. I was like, man, you can't do that. You have to pick up after yourselves.
And we, to that point, we understand that we have an individual who is typically, if they're being dealt with harm reduction, has a significant substance use disorder, which is probably co-occurring with homelessness and whatever else. But we also want them to understand that you're in crisis and your life's in chaos, but you still have to be responsible. You know, what you do to yourself, you know, we don't want you to harm yourself, but ultimately that's your decision, and we're trying to help you out of that. But to her point, what you do to people's property, what you do to, you know, in public, it's like you have to have respect for the community and for others in the community. So, yes, to her point, we do not
and one
say
of the
that.
things that we found the first night when we were doing the evening outreach is that people don't have trash bags, and they ask for trash bags, like little ones. I gave them, so like I took all my home shopping bags and folded them up and brought them in. So now, because he's like, do you have anything for me to put my trash in? I'm like, absolutely. So we can collect trash.
you guys give out trash bags too. You guys give out trash bags
We give
too,
out a
trash
lot of stuff.
reduction.
You do, yeah. Tampons, feminine products, trash cans, just the small ones.
Peter, Councilmember.
Well, thank you. So first of all, thank you all for being here and for that excellent presentation. I think, in my experience, when, as Councilman Alshire refers to, you know, the average citizen doesn't know all the facts, I think they tend to fill in the gaps, and sometimes that's not accurate. And I also believe that when people in positions of leadership, you know, write things on Facebook as opposed to having conversations with other people in positions of leadership, that continues to exacerbate the perception, you know, and reality issue. So having said that, when I read Senator Quarterman's letter, which again, I'll restate, I do not agree with characterizations or even some of the facts that he mentioned, or opinions, I should say, that he gave. You know, I kind of focused in on this one, and it's not to take away from any of the other issues that he wants to address, but it also, I saw it as an attack on the entirety of the harm reduction program, as opposed to a complaint about needle litter, to use the term. So my brain started turning and said, okay, how can we address what the perceived and quite frankly real issue is, which is syringes that are left behind for whatever reason by whomever. And that's when I reached out to you all at the health department, but also I reached out to Councilwoman McIntyre because long before I got here, 5 years ago, they just celebrated their 5th anniversary, Councilwoman McIntyre and then Councilwoman Emily Keller brainstormed and came up with the idea of the Bridge to Change program, which is currently facilitated by REACH, a nonprofit in our community, and I believe has some city funding as part of that. And I thought, okay, how can we use the resources that are out there to try to help support the effort that you all are already making, obviously successfully, if you're collecting back thousands more syringes than are going out your door, how can we help support that? So I'm pleased to say that we did call a meeting and had a discussion with the executive director of REACH, who facilitates the Bridge to Change program, and talked about redirecting their efforts from the traditional just picking up trash, which is that the purpose of that program, to focusing on recollecting any syringes that are identified in various locations. Also talk to the health department about providing training. While it's not significantly difficult, but one should know how to pick up a used syringe, and providing PPE, personal protective equipment, i.e. the right gloves that a person should be wearing. And sometimes, I don't know if it was the city that's providing them or you guys, I don't remember, but providing also the kind of the grabbers, as well as, and I'll just pull these up, the appropriate receptacles for used syringes.
Oh, no, because you can,
It just,
once it's full, it will clip
Yeah.
closed.
so these are just two examples. This is obviously a more, individual one. This is pretty much like you see in any doctor's office, that gives, injections and referred to as sharps containers. So providing these to the folks, and this is all on top of what, quite frankly, I learned that the health department is already doing, as was mentioned, every day.
We're extremely efficient.
And you're very efficient. That's true. I found that out firsthand. And so I'm pleased to say that REACH has agreed to work in conjunction with the health department. And then I've also made an ask because, as one of you guys said, I'm not sure who said it, just a little bit ago, sometimes there's a lack of public awareness. So you have a phone number that people can call, and you get calls, but not a lot of calls. And I think in general, it's because the citizens of Hagerstown don't know. So my ask was, hey, can you guys put together not only the cooperative part with what you're doing with REACH and the Bridge to Change program, but a more robust hotline. So I think you've got some ideas on that, and I wanted to ask you to share those as well.
Okay. So we're still kind of working on the hotline, but we do have a number that goes to 3 different phones that we'll be using. The 3310 number goes to the after hours, and it automatically comes to me anyways. So we'll use that number. Then we'll use our Facebook, because we wanted tons of different things, right?
Lots of
different ways.
communication styles, yeah.
The Facebook for our behavioral health services messenger, and then they can text the crisis line, and it will go to my phone. So there's like all these different things. I just have to iron it all out and
Figure out when you're gonna sleep.
finish out the camp. I doubt that many people are gonna call. I mean, honestly, I figure people really call during the day when they can see a syringe. So it's probably gonna be more daylight and things like that. So it's fine.
I mean,
we'll
I'm
work it
sure
out.
we'll be passing the number out, and that way, the
I have
folks get.
we're gonna do an advertisement. We're
Okay.
gonna give it to you to put on the city. I already have the little video made and everything. So it's just a matter of ironing out those numbers for other numbers to get it rolling.
Yeah, I'm saying that because I listen to a lot of conflict, and sometimes I'm on the phone. And last night after the meeting, I was on the phone with a couple of different homeowners, and sometimes it takes a lot of muscle to reflect so people feel heard and understood around any of their conflict, and especially around personal property. But I was on the phone last night for about an hour. just listening to a homeowner. And if they could have a space that they could feel like just that they're feeling hurt, or even that someone, call this hotline, your address now, they know that there's an issue there, you guys will send people out, all the things you just shared you were doing. I think that would help much better than for me and I love to do that work. That's not, but on top of being the mayor of the city and then trying to make sure that the community, all of it, right, feels heard and understood no matter what. And I care about all of the services, and I also care about all of the people. And so I think that the hotline is an amazing idea. And I would definitely volunteer some of my time to work the hotline just for that reflective listening, so that I could do that outside of being the mayor, because it's very difficult to make sure I'm listening for public safety, and that being my number one concern as the mayor of the city, but then also that they have enough, that I've reflected back enough where their feelings and values are.
And just to add to that, I think one thing is about the outreach is that we're not just outreaching to individuals who use substances, we're also outreaching to people that are in the area where there might be heavy substance use. So we have conversations with neighbors, because we follow up on every overdose report we get through the medical system. And so I always say, they're like, well, we didn't see the person. I'm like, but you saw a neighbor or you saw someone on the street, and they have those conversations. So we are able to do that. So it's not just that type of outreach either.
For the hotline, once that's established and you get the calls, will you take notice of the same areas that's popping up that may not be known?
Yes.
So if that's the case, can you also communicate that to the city?
Yep.
Because again, like Councilmember Alshire said about the lighting, I know we have light money at one
We
point.
just addressed Clarkson Avenue last week.
Yeah.
It was
if we could know those
Matthews.
Matthews Alley.
Yep. The one off Antietam. Yep.
Yep.
Oh, that's where we were.
I think it'll be interesting too, if when Bridge to Change and you collaborate, which is an excellent idea, thank you, Peter, for expanding that, to see where these needles are concentrated and collected, because I know how it works, that Reach, Eric
Right.
says where they go, and this is where they go, and kind of like evaluate that data to see if there's more of a concentration that the health department needs to put, or any other organization and resource that we may have. So thank you very much for thinking outside the box. I appreciate it.
All right, you guys, any more questions? Peter?
Just thank you for being here.
Thank you.
Explanation. Appreciate it.
Thank you guys for your
Thank you
support,
guys
we
for the work.
appreciate
Thank
it.
you so much.
Thanks.